Did you know that one of the deadliest cancers in adults over 60 often starts with symptoms so ordinary most people explain them away for weeks, sometimes months? That is what makes pancreatic cancer so dangerous. Not always that it appears out of nowhere, but that it often shows up wearing the mask of things seniors have been taught to ignore: aging, indigestion, back pain, low energy, a change in appetite, stress, poor sleep. And by the time many people realize those signals were never normal to begin with, the window for easier treatment is already much smaller. I'm Dr. Elias Novak, and in the next few minutes, I'm going to walk you through 8 early symptoms of pancreatic cancer every senior should know. Now let me be clear from the start. Most people who have one of these symptoms do not have pancreatic cancer. These symptoms can happen for many other reasons, but when they appear without a clear explanation, when they start stacking up, or when they keep returning, they deserve attention. Because pancreatic cancer is one of those diseases where timing changes everything. The earlier it is found, the more options you usually have. The later it is found, the fewer chances you get. And that is exactly why you need to hear all 8 of these signs, especially symptom number 5. That one can send someone to the emergency room before anyone even thinks to look at the pancreas. So stay with me, because the pattern matters more than any one symptom by itself. The first symptom is dark urine. A lot of seniors notice this and do the same thing. They drink more water. The urine looks lighter for a little while. They assume the problem is fixed. Then it comes back, and they blame dehydration again. But when dark urine keeps returning, especially when it looks deeper yellow, amber, brown, or almost tea-colored, that can be a warning sign you should not brush aside. Here is why. Your liver produces a substance called bilirubin. Normally, bilirubin travels through the bile duct into the intestines, where it helps give stool its normal brown color. But when something blocks that flow, bilirubin can build up in the bloodstream, and your kidneys start pushing more of it out through your urine. That is why urine can turn darker. Now, dark urine by itself does not prove anything. Dehydration can do it. Some medications can do it. Even certain foods can change color. But when it keeps returning, especially alongside pale stool, itching, yellowing of the eyes, nausea, or upper abdominal discomfort, it stops looking like a hydration issue and starts looking like something that needs medical attention. If you have noticed dark urine that keeps coming back and you cannot clearly explain why, do not just keep watching it. Mention it. The second symptom is a very specific kind of pain. Not just random back pain. Not just, my stomach has been off. Pancreatic cancer can cause pain in the upper abdomen that spreads into the back. And the pattern matters. Many people describe it as a dull, persistent ache high in the belly, sometimes right below the breastbone, sometimes a little to the left, that seems to travel through to the middle back. For some people, it feels like pressure. For others, it feels like a deep ache they cannot quite stretch out or massage away. What makes this symptom more suspicious is how it behaves. It can feel worse after eating. It can feel worse when lying flat. And it may ease a little when leaning forward. That combination matters because the pancreas sits deep in the upper abdomen, near important nerves and digestive structures. When something is wrong there, the pain often does not stay neatly in one place. And that is exactly why so many seniors misread it. They call it acid reflux. They call it posture. They call it a pulled muscle. They call it arthritis. They call it one bad mattress after another. Again, most back pain is not pancreatic cancer. Most abdominal pain is not pancreatic cancer. But upper abdominal pain that radiates to the back and follows this pattern deserves a closer look, especially if it is new, persistent, or getting worse. The third symptom is feeling full too quickly. This one gets ignored all the time because it sounds almost harmless. You sit down to eat, take a few bites, and suddenly you are done. You do not feel normal hunger. You feel full faster than you used to. Maybe meals start feeling heavier. Maybe you feel bloated after eating. Maybe you start avoiding larger meals without really deciding to. Many seniors assume this is just age. But when a tumor affects the pancreas or presses on nearby digestive structures, it can change how food moves and how digestion feels. Some people develop nausea after meals. Some feel uncomfortable pressure. Some simply lose the desire to finish food they once ate easily. And this is where the danger begins. Because once appetite drops, weight often follows. That weight loss may look small at first. 5 pounds, 8 pounds, 10 pounds. Someone compliments you. You shrug it off. You say you were not trying. But maybe it is not a bad thing. Except unexplained weight loss is never something to celebrate automatically, especially later in life. If you are feeling full, unusually fast, eating less without meaning to, or losing weight without trying, do not call that normal until someone has helped explain it. The fourth symptom is jaundice, and the related changes that often come with it. Most people know jaundice means yellowing of the skin or the whites of the eyes. What fewer people realize is that jaundice often does not arrive alone. It often comes with dark urine. It often comes with pale or greasy stool. It can come with intense itching. And sometimes the eyes show the change before the skin does. This happens because bilirubin is building up in the body instead of flowing out the way it should. And here is the part seniors need to understand. Jaundice is not specific to pancreatic cancer. Gallstones can cause it. Liver problems can cause it. Other bile duct conditions can cause it. But when jaundice appears together with loss of appetite, upper belly or back pain, unexplained weight loss, dark urine, pale stool, or itching, the whole picture becomes much more concerning. That is why isolated symptoms can be misleading, but patterns are powerful. If someone notices yellowing and treats it like a cosmetic change instead of a medical signal, precious time can be lost. And if you are still with me, good. Because symptom number 5 is the one many families never see coming. It does not look like a pancreas problem. It looks like a circulation problem, a leg problem, sometimes even a lung problem. Symptom number 5 is an unexplained blood clot. This is one of the most overlooked warning signs because the connection is not obvious. Sometimes the first major clue is pain, swelling, warmth, or redness in one leg, often the calf. A person thinks they twisted something. They think they sat too long. They think it will settle down. But blood clots can be dangerous on their own, and in some people, they are linked to cancer because cancer can change the way blood clots inside the body. Now let me say this carefully. Most blood clots are not caused by pancreatic cancer. There are many other common reasons clots happen, but when a clot appears without a clear explanation, especially in someone who also has weight loss, fatigue, loss of appetite, abdominal discomfort, back pain, or jaundice, the possibility should not be ignored. And if a clot breaks loose and travels to the lungs, it can cause sudden shortness of breath, chest pain, or rapid heartbeat. That is an emergency. This symptom matters because it often looks completely separate from digestion, so the underlying cause can be missed. That is why I said earlier, this one can put someone in the ER before anyone thinks about the pancreas. The 6th symptom is new-onset diabetes, or diabetes that suddenly becomes harder to control. This one deserves far more attention than it gets. Your pancreas plays a central role in blood sugar control because it helps produce insulin. When something interferes with that process, blood sugar can start behaving differently. For some seniors, the first clue is a new diagnosis of diabetes that seems to come out of nowhere. For others, it is diabetes they already had, but suddenly it becomes harder to manage for reasons that are not obvious. Maybe blood sugar starts running higher than usual. Maybe medications do not seem to work the same way. Maybe thirst increases. Maybe urination becomes more frequent. Maybe there is unexplained weight loss at the same time. Now, diabetes is extremely common, and most diabetes has nothing to do with pancreatic cancer. But when a new diabetes diagnosis appears alongside appetite changes, belly pain, back pain, weight loss, or fatigue, it should raise a different level of attention. This is one of those symptoms that does not feel dramatic enough to scare people. That is exactly why it gets overlooked. The 7th symptom is exhaustion. that does not behave like normal tiredness. Everyone gets tired. That is not the issue. The issue is fatigue that feels out of proportion to your life. You slept, but you still wake up drained. You rest, but you do not recover. Simple tasks begin to feel heavier than they should. Walking to the mailbox, climbing stairs, cooking a meal, carrying groceries, all of it starts taking more out of you than it used to. This kind of fatigue is easy to dismiss because it is so common in later life and can happen for dozens of reasons. But when it is new, persistent, and paired with loss of appetite, weight loss, digestive changes, pain, or blood sugar changes, it becomes much more significant. The important thing here is not just tiredness, it is unexplained tiredness. Tiredness that keeps building. Tiredness that does not fit your routine. Tiredness that arrives with other changes you cannot quite explain. Do not accept every new symptom as age before asking whether it makes medical sense. And now we come to the 8th symptom, the one that many people are too embarrassed to talk about, even though it may be one of the clearest digestive clues. Changes in stool. Specifically, stool that becomes pale, greasy, unusually foul-smelling, or starts floating more often than usual. Here is why that matters. The pancreas helps release enzymes that break down fat. If the pancreas is not doing that properly, fat may not be digested the way it should be. And when that happens, stool can change in ways people often notice but hesitate to mention. It may look lighter in color. It may leave an oily appearance. It may float. It may be harder to flush. It may come with bloating, nausea, or discomfort after richer meals. People often blame this on one bad dinner, a stomach bug, or something they ate over the weekend. But if those stool changes keep happening, especially with weight loss or a poor appetite, they need to be taken seriously. And now that you have heard all 8, I want you to step back and notice something important. None of these symptoms on their own automatically means pancreatic cancer. That is not the message. The message is that pancreatic cancer is dangerous because it often hides inside ordinary explanations. One symptom gets called dehydration, another gets called back pain, another gets called aging, another gets called indigestion, another gets called stress. And while each symptom alone may seem easy to dismiss, the pattern they create is what should stop you in your tracks. Dark urine, upper abdominal pain that moves to the back, feeling full too quickly, jaundice or itching, an unexplained blood clot, new or worsening diabetes, persistent fatigue, pale, greasy, floating stool. If 2 or more of those have started showing up in your life, or in the life of someone you love, do not wait around hoping they will organize themselves into a clearer warning later. Take action while the signal is still early enough to matter. Here is exactly what to do. Write the symptoms down, not vaguely, specifically. Write what changed, when it started, how often it happens, whether it is getting worse, what seems to trigger it, and whether weight, appetite, stool, urine, pain, or energy have changed at the same time. Then call your doctor and read the list exactly as it is. Do not minimize it. Do not soften it. Do not say, "I've just been feeling off." Specific symptoms get specific follow-up. Vague complaints often get vague reassurance. And if your symptoms are persistent or concerning, ask whether further evaluation is appropriate. That may include blood work, imaging, or referral, depending on the full picture. The goal is not panic. The goal is not self-diagnosis. The goal is to stop mistaking a meaningful pattern for just getting older. That mistake is made every single day. And if this message helped you connect symptoms in a way you had never thought about before, then do one more thing. Share it with the person who keeps saying they are fine, the one who has lost weight and laughs it off, the one whose back has been hurting after meals, the one who says food just does not taste the same anymore, the one who is suddenly tired all the time, the one who keeps calling it age. Sometimes the most important health conversation starts with one person finally recognizing that a pattern is not random. I'm Dr. Elias Novak, and if even one part of this sounded familiar, do not ignore it. Get it checked. Because when your body